Well, I can tell with the weather, as usual, a lot of people are feeling more stiff and sore today.
Yeah, you get the storms coming in. It's like you can kind of predict everybody's going to come in and be like, oh, I hurt a little bit more. I'm stiff. And it's always a challenge when the weather fronts come in and puts everybody in a little different mood, too. And we just try to make the best part of their day.
Right, exactly.
Have some fun, have some laughs back there. That helps. We'll see the patients kind of progress through, and they do pretty good. A lot of people come in, a lot of clinics, they go and they treat a shoulder injury.
Yep.
They treat a low back injury. When people are in car crashes, their neck hurts, their low back hurts, they have a concussion, they hurt their shoulder, they hurt everything. They have everything. So we got to kind of try to prioritize, because unfortunately it's not a full-time job for people to do rehab.
Right.
You know, if you're J.J. McCarthy, it's your full-time job. You know?
You're always hurt.
Yeah, right, he's always hurt. But here, people got a limited amount of time, so we have to kind of prioritize. And we'll take them through, you know, most commonly it's the neck and the low back. So we kind of probably put more emphasis on that, right?
Yep.
Get them going on Med-X. But then at the end, it's like, my shoulder still hurts. Everything's doing pretty good. My shoulder's a lot better. It still hurts. And then we've started doing the dry needling. Yeah. And sometimes then we're like, okay, let's start doing the dry needling, and we'll put the needles in, which is kind of scary to people. Right. You put needles in my shoulder, and I'll like, oh, it's comfortable. You know, you've had it done.
Oh yeah, it's really helped my shoulders. I had it done to my low back and my neck, and I mean, once you explain it, it's a little like, oh, what are you going to do? But then once you have it done, it's, a lot of benefit from it.
We hook up the electrical stimulation to it. It's real comfortable. It feels good. And it really turns things around for a lot of people. I've had it done to myself, too. I'll have, Dr. Talbot will needle me. Dr. Lutz and Dr. Horn will do acupuncture and dry needling, too. So we have a lot of different providers that do it. But that's kind of one thing that we've probably added in, the last 4 or 5 years. That's, I think, really helped a lot of people out, too, where we didn't have that option before now. Yeah. But we couple that with the active rehab, the Med-X, the strengthening, the chiropractic care, and we're really getting good outcomes without having to have people, undergo other injections. The injections are bigger needles.
Yeah, right.
Tiny needles for acupuncture.
Pick your, what would you rather try first?
Yeah, that's what we should have, like a comparison needle. Like, do you want the dry needling acupuncture needle, or would you like the big monster?
Right. I'll take the acupuncture needle.
Acupuncture needle. Yeah, that's a lot better, but. Yeah, it's a fun thing to do. Yeah. People usually respond really well, and after they do it once, they're like, oh, yeah, I didn't even feel that. Yeah. A lot of times. So it's cool, very cool.
Yeah, compared to some clinics, like you said, deal with just hip rehab or knee rehab or shoulder rehab. It is a different animal when you're treating so many things at once, but that's really what we're experts at here because we see that all the time. Yeah. And a lot of clinics, I would assume, would be overwhelmed with that. Like, how do you do all these exercises for all these things? But really, we kind of know what the focus is on, what it gets better by itself, what needs a little bit more help.
Where to put the attention. Yeah, it's like when we have students here and you take them into an exam and somebody starts listing off the things that's wrong, and I look back at the students and their eyes are getting
glossed over.
And I'm like, all right, what do you want to do?
Right.
And the student like, we're fine. This person's going to be good. We're going to take care of them. They're going to get better, and it's going to be fun.
Yeah.